Hi, my name is Dr. Wendy Leonard, and I am the founder and executive director of TIP Global Health. I am passionate about the potential of high quality healthcare to transform lives and contribute to equitable and thriving communities. I have always wanted to be a doctor. I learned firsthand about the power of healthcare and relationships within it when I was just 9 years old. I was always holding my head to my shoulder like this, and everyone assumed it was just because I was shy, because I was very shy. Well, it turned out it was because the muscle in my neck was too short. So my mom took me to the orthopedic surgeon to discuss surgery options, and he started to draw images on the exam table paper of what was happening and what he was going to do about it. Well, my mom freaked out and told him to stop scaring me. And the surgeon looked at her and he said, why? She needs to know what's happening to her. That was one of the most powerful moments of my life. This person believed that I could handle this important conversation, and he valued me enough to advocate for me to be a part of what was happening to my body. This is when I knew I wanted to be a physician. He gave me so much hope. And it wasn't just about my own health condition. What he didn't realize is that my father, who was a successful engineer, was struggling with alcoholism. I was convinced that as soon as my dad went to the doctor, he would receive this kind of care and he would have all the tools he would need to get well. Well, unfortunately, far too many people around the world do not receive this kind of care. So fast forward to when I became a physician. As a primary care physician, I have worked with marginalized communities and low-income settings for over 20 years. I've come to realize that there is a fundamental lack of understanding about what primary healthcare is and what it takes to do it well. Whether we're talking about a woman having a healthy pregnancy or a healthy child, managing diabetes or managing HIV, it's all about preventing problems before they begin, diagnosing and treating problems early when they occur, and ensuring ongoing management of conditions to prevent complications. It is very difficult to convince someone without symptoms today to change their lifestyle for an unknown future risk. This is even harder for someone who has been marginalized by socioeconomic factors and are in survival mode. The provider-patient relationship can become a really critical driver for success. Unfortunately, I quickly learned that the sick care health systems that we currently work in are poorly designed to support effective primary health care. When I traveled to Rwanda in 2006, I realized that my colleagues were struggling with some of the same pressures, but in much more dire circumstances, struggling to manage national government priorities and expectations while trying to meet the most pressing needs of their communities with limited resources. The difference? In Rwanda, everyone from the national government to frontline healthcare workers to community members were eager to innovate and solve these challenges that they were facing to delivering high quality care under the stressful circumstances. So I founded TIP Global Health in collaboration with the communities in Rwanda to support community-driven innovation within existing national health systems to achieve lasting improvements in health outcomes. As global advocates for frontline healthcare workers, my team and I utilize rigorous research methods to demonstrate the critical role that a clinician-patient relationship plays in the delivery of highly effective primary healthcare. We work alongside frontline health workers, communities, and governments to design, test, implement, and scale effective solutions that strengthen this relationship to improve quality and efficiency of care, foster healthy behavior change, prevent burnout, and achieve lasting improvements in health outcomes. Elevate Prize leaders, thank you so very much for the opportunity to tell our story. I invite you to join TIP Global Health as we transform healthcare systems around the globe. Thank you very much.